Have you ever heard of G-spot enhancement procedures? In this video, you will learn about the O-shot. It is meant to increase the female sexual experience by injecting PRP into the area of the G-spot. Whoa, wait a minute. That was a lot of cryptic information in one sentence. In a second, I will break it down for you. You will not only be able to understand what PRP is and how the O-shot works, I also have a bonus for you. If you watch this video, you will also be able to locate the G-spot. It's not as difficult as you might think. My name is Stefan Buntrock and I'm a board-certified urologist and sexologist. Let's start with PRP. PRP means platelet-rich plasma. Here's how it works. First, you need to draw some blood. I mean, your own blood. I have a high-tech centrifuge for processing the blood. For my purposes, I need 60 milliliters of blood. The machine spins it around. After 20 minutes, it starts to separate the blood into its different components. It uses some kind of optical gate control for this. So the blood travels in a tube via this gate. The machine is able to identify platelets and fills platelet-containing plasma into a syringe. The red blood cells are redirected into a bag, and blood plasma without any platelets end up in another compartment of the collection bag. The PRP I get from my machine contains 1.5 billion platelets per milliliter. That's 8.5 times higher than in 1 milliliter of blood. Platelets contain a plethora of growth factors which promote tissue rejuvenation and regeneration. PRP also promotes wound healing and reduces inflammation, by the way. This means when PRP is injected into the target location, which is the G-spot for the purpose of this video, its regenerative properties will be beneficial for the female sexual experience. It may also counteract problems with dryness and pain during sexual activity. Some practitioners also use PRP on the clitoris. I mean, this is logical, as PRP is used on the penis as well, which is called the P-shot. Is this standard procedure? As far as I know, the guidelines have not acknowledged the O-shot as a standard treatment. However, it is safe because it's the patient's own blood. No medication involved. This means that the risk for side effects is very low. Okay, now where's the G-spot? The G-spot, also known as Grafenberg spot, is located in the anterior vaginal wall. Let's have a look at the anatomy with a 3D medical anatomical model. Here we have our 3D anatomical model of the organs of the small pelvis of the female. And you can see here, this is the bladder with the urethra leading to the urethral opening around here. And behind the urethra, it's the entrance into the vagina, which you can see here as this small tube. If I just take away the walls of the vagina, we can have a look at the cervix, which is this structure here. Here you have your cervix. And the G-spot is a little bit underneath the cervix and behind the bladder. This is the anterior vaginal wall. And here you have to look for the G-spot. PRP is a very promising therapy emerging in the growing field of regenerative therapies right now. I think the biggest problem to date is its lack of standardization in terms of PRP production. I looked at all the publications on the P-shot to find out how they obtained the product and whether they actually checked how many platelets it contained. I have to say, hardly anyone reports these numbers. So I suspect they never questioned the quality of the PRP they injected. If you are curious now and want to find out if the P-shot could be the right treatment for you, these two videos will be of interest for you. Please remember, a video cannot replace a medical consultation and is not medical advice. Should you experience health problems, please talk to your local doctor. Thanks for watching. Bye-bye.